Hi, my name is Jennifer Rogers. I'm a nurse practitioner student at Maryville University, and this is my head to toe exam. This is Brooke. She's volunteered to be my patient today. Prior to this, I've had her change into a gown, empty her bladder. We did her vital signs, which included heart rate, blood pressure, respiratory rate, oxygen, pain. We also did her height, weight, BMI. We tested her distance vision with the Snellen chart, and then we did her near vision with the Rosenbaum charts. So first we're going to start with your head and your scalp. So I'm just going to inspect and look at your skin, and it looks nice and smooth. Coloration is all throughout the same. And then I'm just going to, while we're here, I'm going to look at your hair and feel for your scalp. Do you feel any tenderness at all?
No.
No? Okay. Feel smooth. I don't feel any bumps or lumps or I don't see any scabbing. While we're here, I'm going to just note that the hair distribution is nice and even. The hair is not too dry, not too coarse. Everything looks good. So then I'm going to palpate your facial bones. Just tell me if you know any tenderness at all. No? Okay. And I didn't notice any swelling or any masses. And then now I'm going to just palpate your around your eyes really quick. Okay. And I'm also going to feel your frontal sinuses and then your maxillary sinuses. Did you know any tenderness there?
No.
Nope. Okay. And then I'm going to look at your eyes. We're going to move into your eyes, okay? So the eyebrows are nice and go out to the outer canthus of your eyes. Can you go ahead and close your eyes for me? Okay. Eyelids are nice and even. You can open your eyes. Eyelids are nice and even. I didn't see any twitching. They close fully. Her eyelashes extend out, and I don't see any crusting or any matting of the eyelids there as well. So I'm going to go ahead and do some cranial nerve testing really quick for your face, okay? So I'm going to have you do a couple things, and then I'm just going to look for symmetry and anything out of the ordinary. So I'm going to have you clench your teeth for me. Go ahead and close your eyes tightly. Wrinkle your forehead. Good. Smile for me. Good. Stick out your tongue, side to side, and then go ahead and puff out your cheeks. Good. Okay. Alrighty. So moving to your ears really quick. I'm just gonna first inspect, and your ears are in line with the inner canthus here of the eyes. They're nice and even symmetrically. Color is even with the face. I'm gonna go ahead and just palpate here. Do you feel any tenderness? Nope. And I don't note any nodules or anything out of the ordinary for that. So we're going to go ahead and we're going to do what's called a whisper test. So I'm going to stand behind you, okay? I'm going to say something and then you're just going to repeat it, okay? Apple.
Apple. Orange.
All right. And then what we're going to do next is I'm going to test your hearing with the tuning fork. And I'm going to place this, we're going to do the Weber test. I'm going to just place this over and just let me know if you can hear it evenly in both of your ears. Okay. Now we're going to do the Rhine test. So I'm going to put behind your mastoid bone, and then when you don't hear that anymore, let me know, and then we'll see your air conduction. Okay. And then we'll do it over here. So let me know when you don't.
Yeah.
Yeah. Okay. Good. And your air conduction should be 2 times that of phone conduction. Okay. So now I'm going to look into your ears really quick here. Okay. going to pull back in and look into your ears. Looks nice. Oh, sorry. Those, no foreign bodies. I don't see any perforation of your um, eardrum, and it's nice and pearly gray. Same there. Okay, next we're gonna do some more with the eyes. Okay, let's see here. I'm gonna grab my pen light, and I'm just gonna test your pupils. Okay, we're gonna do direct and consensual pupils. Okay, so go ahead and direct, consensual, direct, consensual. All right. I'm going to do the red reflex now, okay? So I'm just going to kind of dim the lights a little more if they will. Okay, so I'm just going to look for a red reflex. Good? Good. Okay. All right, now we're going to test your visual. We're going to do the cardinal gaze view, okay? So just follow my pen light, okay? Just with your eyes, keep your head straight. Good. I didn't notice any nystagmus or any involuntary movements. Now we're going to do the cover-uncover test, okay? So I'm going to ask that you cover one eye and look with your other eye just forward, okay? And then go ahead and uncover your eye, and then go ahead and do that with your other eye and uncover it. Okay, perfect. Now we're going to test your peripheral vision, okay? So I'm going to have you cover one of your eyes. For this one, just tell me whenever you see my hand out of the corner of your eye, okay? Which eye? The one that's open. Yep. Yep. Okay, we're going to switch eyes. Okay. Okay. Next, we're going to move and look into your nose, okay? So now we're going to look just kind of at your nose. It's nice and midline, in the middle of your face. Your nares aren't flaring at all. So I'm just going to take a look in your nose now. So go ahead and use this light. Go ahead and flip your head back here. I'm just going to look. All right, and the turbinates and the mucus are nice and moist and pink. I don't see any polyps or any foreign objects, and the septum is nice and midline, no deviation. Okay, now we are going to do the patency of your nostril. So go ahead and close one for me, and go ahead and blow in and blow out. Then do that to the other side. Okay, perfect. Next, we're going to move on to your mouth. Okay, so I'm just going to look at your mouth. Lips are nice and moist and pink. I don't see any cracks or fissures or any lesions on the mouth. So I'm going to go ahead and grab my pen light. I'm going to have you just open your mouth first. Okay, we're going to look at the tongue. I'm going to look at the mucosal, the nice pink and moist. Hard palate, soft palate. And look at your uvula, your tonsils, and then I'm going to go ahead and have you touch the top of your tongue there with the roof of your mouth. So I can look at the floor of your tongue there. I don't see any lesions or lumps or anything that's not supposed to be there. Your frenulum's nice and intact. You can go ahead and, okay. And then I'm just going to look at your teeth real quick. So nice and white. I don't see any gingivitis or any bleeding to your gums. So, okay, alrighty. And what I'm going to do is I'm also going to do your gag reflex, okay? So I'm going to just tell me, or just, oh, sorry about that. Are you okay? Yeah. Okay. And then the only other thing I'm going to do is I'm going to have you say ah, because I'm going to watch your, the soft palate rise, and I'm going to watch your uvula. Okay, looks good. All right. Now we are going to move on to your neck. It's nice and supple. It's midline with your body. I don't see any swelling or masses. Trachea is midline. I don't see any goiters. So I'm going to just go ahead and feel here. Any tenderness at all? No? Okay. While I'm here, I'm going to go ahead and just test your lymph nodes. So I'm going to go ahead and this is your preocular, postocular, occipital. I'm going to look at your tonsillar, submental, submandibular, superficial cervical chain, posterior cervical chain. I'm going to look deep cervical, supraclavicular, infraclavicular, and then I'm going to go ahead and just do your axillary while we're doing this. So, just go ahead and do this. Sorry. Here. There. Okay, thank you. All right, and I'm going to do light fixation here. So I'm going to have you close your eyes, and I'm just going to have you tell me you feel equal on both sides, equal on both sides, and equal on both sides. Okay, perfect. Okay, so now I'm going to just do your trachea right here, nice and midline. I am going to have you, I'm going to feel your thyroid. Go ahead and just swallow for me. Good. Nice rise up and down with the swallow. I didn't notice any nodules whenever you did that. Okay, so now I'm going to have you, I'm going to do some movements here. I'm going to have you bend your head, touch your chin to your chest, go backwards, okay? And then bring it up and go shoulder to ear on both sides, and then turn side to side. Perfect. Now I'm going to apply pressure. So try to go forward, good, backwards, ear to, okay, and then side to side. Okay, alrighty. So that's nice and strong. Go ahead and shrug your shoulders for me. Good, okay. And then I'm going to have you shrug again while I do that. So now we're going to move to your chest, okay? What I'm going to do is I'm going to assess your back chest first, okay? But just going to turn that way would be good. Okay, so first I'm just going to inspect here and just looking at the rise and fall of the chest. It's nice and even. I don't see that she is having any difficulty breathing. And I'm going to go ahead and I'm just going to palpate here, any tenderness. Good, okay. And I'm going to now do tactile thermometer. I'm going to assess for that. So if you would go ahead and just, every time I place my hands here, just say 99. 99, 99, 99, 99. Okay, perfect. And then I am going to, while I'm here, I'm going to go ahead and just do look for thoracic expansion. I'm going to put it on the 10th rib, and I want you to give me a nice inhale and exhale. Okay, and everything rose evenly and came back down, nice and even. Now I'm going to go ahead and I'm going to palpate. I'm going to do the back first, and I will do the your lateral side. So I'm going to go ahead and do this. And what we're listening for is resonance. Okay, and I'm going to have you raise your arms while I do your sides here in a nice symmetric fashion. Okay, you can go ahead and lower your arms. That's nice and resonant. Now I'm going to do diaphragmatic excursion. So what I'm going to do is I'm going to measure, and I'm going to go from an area of resonance, and I'm trying to go to an area of dull to see the distance between that. So, and then we'll mark that area with a piece of tape. So I'm just going to I'm going to mark that with a piece of tape. Oh, I'm sorry, I'm actually going to have you kind of bend forward here. I'm sorry about that. And I'm going to have you go ahead and take a big, deep inhale and hold your breath. Okay, go ahead and breathe. breath, and then I'm going to go ahead and have you blow out and hold it. And from there, I was going from dull to resonance. And now what we'll do is we'll measure the distance, and usually it is 3 to 5 centimeters is normal, and you were right at 5 centimeters. So I'm going to go ahead and remove this tape. Sorry about that. Okay. So then now I'm going to move into the, I'm going to have you kind of turn around here. We'll do your anterior chest. And we're going to kind of do the same thing that we did on the back, okay? And then I do have to also look at your lungs, but I'll go ahead and just do that front and back at the same time. I'm just going to kind of go here and just look at your breathing. I don't see any use of your accessory muscles. I don't see any retractions. Rate and rhythm is nice. Rise and fall is symmetric. And I don't notice any, any swelling or anything in your lungs that I need to be concerned for. I don't see any your lips aren't blue. I don't see any signs of cyanosis. So what I'm going to do here is just kind of feel again. All right. And then I'm just going to go ahead and I'm just going to palpate here again. Hearing all resonance. Sorry. And here I'm going to go ahead and just do expansion as well and see if you rise and fall. Good. All right. Good. Okay. And then I'm going to do your lateral side here from the front as well. I did do it from the back side, but we will go ahead and just do it here as well. Okay, perfect. So I'm going to go ahead and I'm going to listen to your lungs. So I'll go ahead and start from the back, and I'll just kind of do the same nice systematic way that I did for palpation. So deep breath in and out. Okay, go ahead and raise your arms for me. Just listen to your chest deep breath. And one more. A couple more here. All right. And now that I'm at your chest, I'm going to go ahead and just listen to your heart, okay? So I'm going to start here. I'm going to listen to your aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to go ahead and I'm just going to place my hand over here at your precordium. I don't feel any thrills or pulsations or any heaves. I'm going to go ahead and do this with your left apical chest, noting rate and rhythm. All right. So now we're going to move to your abdomen, okay? So if I could just have you lay back, pull this out, okay? Okay, so we're just gonna, first we're gonna inspect the stomach. We're just gonna look at the color of it. I don't notice any discolorations. I don't see any pulsations. I don't see any lumps or any hernias. So next I'm gonna go ahead and I'm gonna auscultate your bowel sounds. And all 4 quadrants, and we would want to listen from a max of 2 to 5 minutes if we don't hear anything. And we would want to note the consistency and of these bowel sounds. Okay. And I'm going to go ahead and I'm going to listen to your aorta with the bell of my stethoscope. And I'm going to listen to your right kidney, the left side, right iliac, right femoral, and left femoral. Okay. Now I'm gonna just kind of percuss over your belly, and here we're gonna want to hear tympani over air. Any dull areas would be your organs. So now what I'm gonna do is I'm gonna percuss for the border of the liver. So I'm gonna go from area of tympani to find area of dull, which is right here. And then I can do this other border going from areas of resonance to dullness. I'm going to do the same for your spleen, okay? And then now I'm going to go ahead and I'm going to do some, sorry, that was percussion. I'm going to do some palpating. Any tenderness there? No, okay. Now we're going to move from light to deep palpation, okay? So I'm going to stick my left hand here under for your liver, and I'm going to just kind of feel for the border here with my right hand. And then I'm going to go ahead and I'm going to do the spleen. I'm going to lift my left arm under here and kind of feel deeply with this. A normal finding would to not be able to feel the spleen. And then I'm going to go ahead and do the same with the left kidney. And then, the right kidney, and then the left kidney. If you feel any tenderness at all there. Okay? And then what I'm going to do while you're down here, I'm going to have you kind of lift your neck up so I can just look at the muscles. Okay? Good. All right. You can go ahead and sit up. All right. While you're sitting there, I am going to listen. I'll look for, I don't see any jugular vein distension at all. I don't see, I'm going to check your carotid pulses. And then I'm going to listen to your carotids and then also your thyroid. So go ahead and hold your breath for me. Bruise or grills. Okay, good. Alrighty. Now I'm going to do your extremities. I'm going to do your upper extremities first. I'm just going to first note their color, and they're nice and symmetric. They're very musculature. No atrophy is noted. I'm going to feel for temperature here. Hair is nice and evenly distributed. I'm going to just look at your nails while I'm here, noting no clubbing. There's no cyanosis noted. Calf refill is nice and brisk. Nail beds look good. Your nails are nice and adhered to the nail bed. I don't see any biting or any shortened nails in that. So now we're going to go ahead and test your strength, okay? So I'm going to have you put your arms out and push up while I push down on you. Okay, now this way, and then go to the side. I'm going to have you go up and down. Okay, perfect. And then I'm going to have you squeeze my fingers here. That's okay. All right, and then I'm going to go ahead and do brachial pulse, radial, brachial, radial. And then I'm also, while I'm here, I'm going to go ahead and I'm going to test your reflexes. So first we'll do brachial, and then we'll do radial. We'll do this side, brachial, radial. And now we're going to move into your lower extremities. I'm going to look at your legs, noting that they're nice and even. Color looks nice. I don't see any bruising. I don't see any lesions or scars or scabs. I don't notice any swelling in the ankles or edema. So I'm going to go ahead and just feel for temperature. It's nice and warm. Okay. And then I'm going to just feel any lumps or bumps. I'm going to go ahead while I'm down here and just feel your popliteal pulses here. Your dorsal Post-tibial. Okay, and then I'm going to go ahead and do your reflexes. So we're going to do your knee, and then your Achilles. Yep. Okay, and then I'm going to have you go ahead and I'm going to have you stand up for me. Sorry. Go ahead and stand up on the ground, and I'm going to note, we're going to look at your muscular spine. So I'm noting that your cervical spine is nice and midline, looking at the thoracic and lumbar spine. So I'm going to have you kind of just go forward for me, just noting, looking for any curvature of the spine, any, does that hurt at all? No? Okay, go ahead and stand up. And that concludes my head to toe assessment. Thank you.